I just want to try to understand this a little bit better. So the data's there, but the data doesn't count right now. Just explain to me why it's not counting at the moment. Why are we not getting it to count?
When people say big data, volume doesn't matter. What matters is complexity and availability. Turns out the complexity can be handled. But really what it comes down to is making the data available, making it liquid so it flows out of these healthcare systems and can be brought to bear and have eyes on it that are not just the usual billers. Most of the electronic health record data is used currently to maximize income. That same data can be used, as I hope I've demonstrated, to discover and deliver better care.
And just tell me, we talked backstage, so you know how dumb I am. So just tell me, just in small, monosyllabic words, what is smart platforms?
Smart platforms is simply this. It says, let's create a tiny little web layer on top of existing electronic health record systems. And it creates a place where you can, forgive the nerddom, an application programmer interface so that you can actually put on top of it these apps, these healthcare apps, and they'll run
some of the analysis that you were talking about.
Exactly.
And some of the partners that you showed up there doing it right now, you had a great example about being able to find analyses in communities like the African American community. Do you have other examples of another unit that is doing this, a kind of open source? What other examples have we got?
Using our software?
Yeah.
Sure. So we have, for instance, Cincinnati Children's is using this software to just improve quality and see where the outliers are for quality. There's a rheumatological network, a pediatric rheumatological network that is looking at the use of the biologicals for the treatment and seeing that there's huge variation and trying to optimize treatment sort of along the way that Steve Gullins just talked about. And
But so why was that not possible before they started using it?
Because what's really happened is by implementing the systems, we took away an excuse not to do it. Previously, people said we could not do it, it was technologically too hard, and that and the excuse around privacy became the reason not to do it.
Right.
So by actually showing that it was feasible and demonstrating how to do it, people have taken not only our software, but our governance, our institutional review board documents, and essentially the imprimatur of these first-class institutions that have taken on this process and say, it's doable. There's nothing stopping you to do this except the will to look at your data and to share.
And so just one last question, because we had a wonderful talk yesterday by a chap called Ryan, who was telling us that HIPAA as a law will actually empowers us as patients. Are you seeing it as something that empowers what you're doing?
I tend to think that most of these laws empower moneyed interests so that they can actually keep the data for their existing purposes. Your data is used by everybody for financial gain all the time. Regulation makes it much more difficult to use it for research. And so, although the way HIPAA is being restated will actually empower patients more, I have to say it's a bit of a rearguard action. Most of the moneyed interests have made sure that the data works well for the existing financial arrangements and makes it considerably difficult to liberate the data that all the patient advocacy communities, and that includes all of us, right, would want.
And while they're applauding, why don't we do your hokey thing one more time?
Make our data count for us.
Thank you very much.